Welcome back to Virginia This Morning. This Partners in Healthcare segment is sponsored by Senior Solutions of Richmond. Caring people, caring for you.
The sandwich generation experiences a time squeeze between caring for their own families and for their aging parents. Where do you find the time? Senior Solutions of Richmond helps many families with this dilemma. Janet Ferrone and Hope Melton join us this morning. Thanks for coming in, ladies.
Thank you, Jessica.
You started this 9 years ago, Janet, and it's just grown from there.
It has, and we've been really fortunate to serve this population. So when we do serve them, we want to make sure that we maximize their quality of life. So we start each client with an assessment conducted either by myself, my husband who's my business partner, social workers such as Hope, or a registered nurse, and we really get a good understanding of their needs. And over the time, we've had clients that we've had this full 9 years, we can adapt their care as their needs change.
And people have a lot of preconceived notions about senior care, but there's definitely a lot to learn. It's really personalized.
It is, and one such situation, we have a client that we've seen through a variety of changes. We started off providing simple things at home like household chores. We were taking her swimming twice a week, but as her needs changed, she went into the hospital, into rehab. We were able to provide the personal care she needed to recover from her illnesses, and now we're actually providing care coordination since her husband passed away. So we are becoming even more involved as her needs have changed.
And we said at the beginning that sandwich generation right now, they're caring for their families, they're increasingly the need for caring for their parents, it's just growing. How do they finally realize it's time and there actually is help available, support available?
I think oftentimes when the family is out there, they're trying to cover their children's needs, their work needs, and then they're running to mom and dad, and while they're there, they're trying to quickly get a meal prepared or do some household chores, and they're getting a really sloppy visit with their family. If we come in just a few hours a week, we can be taking some of those chores off their hands so that when they're visiting with mom and dad, they get a quality visit.
And also, we have folks who don't have family locally, so we can come in and serve as kind of a surrogate daughter or son and provide oversight for changes that are taking place and keeping the family informed.
It really does bridge that gap and makes everybody feel more connected. Now, you have a program called Beyond Home Care, and tell me about that.
We do. It's we're so well connected with other resources that are out there. That we want to be able to let folks know about those resources. So it may be something as simple as we've got an active adult in the home that really might want to be connected to the senior center so that they can go do some activities. It might be a situation where we have a client that we've had for a while, but they can no longer afford the right amount of home care that they need to safely remain at home. So we're going to help them get connected to an assisted living community that's right for them.
And we're also connecting people with community resources that they aren't aware of. Everything from hospice to an elder law attorney, getting them connected with a durable medical equipment company.
So it really is multifaceted care. And it's not just in the home either.
No, it's not. We can be working with someone in assisted living. When they move into assisted living, that becomes their home. But sometimes there may be something that happens to them that requires some one-on-one care, which we can provide. They may be recovering from a surgery, from a fall. Their health may be declining. They may be in a hospice situation. So we come in and we can provide that one-on-one care for them so that they can remain in their home, which is the assisted living community.
We also do work in hospitals. If somebody's going in for treatment or recovery from an injury, we can just be there to be company. If the family can't stay overnight, whether it's night or day, we can have a caregiver there.
Well, it's great to know support is there. Thank you, ladies.
Thank you.
Senior Solutions of Richmond is one of the partners in healthcare, caring people, caring for you in the greater Richmond area. Give them a call, 364-1276, or visit online, srsolutionsinc.com. We'll be right back with more Virginia This Morning.